Welcome, everybody. Thanks for the afternoon. So we are behavior and autism and all the fun things that go along with it. I can only assume have autism, or that you know somebody that went through this today. And if we've got, so just bear with me through this. So my name is Dr. Brooks. I own out of Dallas, Texas, and my practice is all focused on early intervention, developmental delays, and behavioral issues. A large majority of the children that I see in my practice have autism or on the spectrum. So this is something that's very close to my own heart and something that I spend my days doing. So I love to be able to share this with parents, providers, or educators, whoever's on the line, to try to help our families get the help that they need and maybe just give a little background as to why behavior can be such an issue with autism. This is just a little bit about me. I have a book that's available that's been very helpful. I actually wrote it for my patients, and it's everything that I would kind of ever want to tell them. So that's 15 things your doctor doesn't know about your child. And of course, I talk about developmental delays, start from, and some of the issues, as well as kind of directions on life and care and your journey, in essence. So you might find that helpful. We also have a nutrient line called Healthy Kids Nutrients, which you can check out. And our website, of course, has tons and tons of research and information to try to help you get the right information and education to find a provider, perhaps in your area if you're out of ours. Obviously, the educational webinars that we're doing like today, those are always available on dramberbrooks.com under education. Just posted the courses for April and May, so you can go check those out. Of course, on Facebook, we're at Whole Child Wellness, and I post a lot of things there that are applicable, mostly, again, towards the special needs forum and always pediatric related, because all I see is kids. And then, of course, on Twitter and on YouTube, short videos I post, which I have really enjoyed doing, because it's a chance for me to do like a 5-minute video on or comments or things that are happening that parents have a lot of questions about. So you can always you can find us at Whole Child Wellness, or if you're on our Facebook, I always stream them through there as well. So those are kind of ways to keep in touch with us and a little bit about my practice. Today, this is a disclaimer of giving you any medical advice. This is simply to give you some education on perhaps what may be going on, so that you can ask the right questions or find the right provider for yourself. So there's that. And then, of course, reproductive rights, all this comes on intellectual property. So we're talking about autism spectrum disorders. Common symptoms. So these are things that parents find that their child has or be telling their doctor about. Some of these things, of course, as parents, you've been told are normal, aren't a big deal, they'll grow out of it, all those fun things, which, quite honestly, really need to be addressed. So I want us to keep that in mind as we go through today. These are common things that you're struggling with at home. Most parents will realize that their child is delayed before their actual diagnosis of autism because of speech. And then it usually gets worse over time. And honestly, most parents end up calling our office when behavior has gotten to be unbearable. So I wanted to focus today on how behavior and autism kind of come into play and what could be going on, because many people are going to therapy and doing speech and occupational therapy, which I love and I'm a big fan of, but they don't know kind of the medical portion of care and maybe what or how to direct you. So I'm hoping to do that for you today. So you might actually read some of these and say, my kid does all of these, some of these, none of these. But these are the most common, and of course this list is pretty much endless, but I wanted to put the ones that, we really see the most. These are the common underlying about the common symptoms or things that you're telling us that are going on, going to your doctor and telling, hey, this is happening. These are usually some of the more common underlying issues. Obviously, in today's society, we're eating a lot of processed foods, and those are stripped of nutrients. So that's an underlying issue why your child could be having an issue. Overconsumption, of course, of meats that are not good for us, in that they're not organic and etc. Obviously, the soil that we're growing is just ridden with pesticides. High fructose corn syrup, malabsorption of foods, that's a big one we're going to talk about today with the autism community specifically. Genetic predispositions, this is a big one. Many of you have probably heard more about this the last couple years because there are some things that we've been able to link. Now, does it mean that if you have those, your child will be autistic? No. It just means that it's something that we may want to keep an eye on. Of course, the mother's history, the family history, the father's history, and what happened before conception is always important. Immune issues, either that run in the family or that the child has environmental contributions. This could be, of course, pesticides that you use in your home, cleaning products, all the way down to medications we give, vaccinations that we give. Those are all contributing factors. And then behavior and neurological system, abnormal detox systems, which if any of you have done some research or perhaps even been to conferences on autism, we talk a lot when we speak at those conferences about their innate inability to detoxify properly. Food sensitivity is always a big topic, always something to find there. Toxic exposures, of course, and then the three that we're actually going to hit the most today, which is GI, the nervous system, and inflammation. So when people want to pinpoint to one reason why a child has autism, it's really hard to do. And I hope by looking over just these that I've mentioned, and there are more, that we can understand that there's not just one cause, that many of these children have several underlying issues, and the real key here is getting to those underlying issues, figuring out what they are, and helping you through repairing them to the best that we can. So here's causes of autism. I just said this is one symptom of an underlying disease process. So it affects the immune system, the GI, the neurological, and the toxicological system. So there's a lot of systems involved when you talk about the autism spectrum. And this is also why I tell parents, this is why we call it a spectrum, because we can have kids from very severe all the way up to a very, very high functioning, wouldn't really know they were, quote, autistic unless someone told them. So this is where we get that range. It's because it all depends on how it's affecting their different systems in their body, and that will depend a lot of times on the severity of what they're presenting with clinically. So how does autism and behavior really mix? And this is probably the easiest, most simplistic way that I can explain it that makes sense. The digestive problems are always an underlying issue. It's not the only issue. It just happens to be the one that can get ignored for a very long period of time, but also when repaired can give you immense improvements. So this is kind of how I walk parents through this. You have digestive problems, which are your underlying issue, and then you have your immune system, which gets overloaded. And that's because 70% of your immune system is in your gut. And once that gets inflamed, it travels up the digestive system to your neurological system, to your brain, which then gives you poor behavior. And this cycle just keeps going and keeps going and keeps going. So children that go under care to do an integrative approach or a biomedical approach, however, whatever word you want to use for it, in essence, it really is the same type of care. It's just a matter of the doctor or clinician figuring out what's happening and what's going wrong, and how do we help you with those underlying issues. And that's why I like to stay in speech and occupational therapy, because as they start to come out of a fog, and that's kind of how I explain it, they usually will do much, much better under care of your therapist. So for example, many times I just had a parent yesterday that said, you know, we started on everything and we're kind of getting to go, and we went to see the speech therapist, and they said, wow, he really wants to talk. I feel like he's very, very much on the path to start words. And that's kind of a drive that gets in them when I always say when they're feeling better, because if your tummy's upset or something's going on that makes you not feel well, therapy will go well to a certain degree, and then they'll just, just have able to a little bit more intensive therapy, maybe a little more on to faster in therapy, which is great because they don't feel good, right? So this is kind of the very basics of why behavior and autism. I have never, ever in the 8 years of practice seen a child with autism that did not have some kind of digestive issue. So it's always a matter, it's not a matter of if it's there, it's a matter of what is it and how bad is it. And that's kind of the range for what I see in practice. How behaviors come from the inside out. So we eat food, we digest it, we absorb it, we assimilate it, and then we excrete it. So where did children with autism have a problem? Well, pretty much at any stage is possible, right? So the eating of the food can be an issue with the picky eater. The digesting of the food is pretty much an issue, I'd say 90% of the time. Absorbing it, again, a big issue most all the time. So they're not taking in the nutrients and pulling from it what it needs to allow the body to function properly, which is why we end up having to do supplementation. So, and then of course excreting it. We've got those children with constipation, only pooping once a week or every other day, which we would ideally want your child pooping every day because they should be excreting those things. So this whole is as simple as it looks. At every stage of this, there's a problem and there's something that we need to overcome a lot of times. It's the picky eating is very, very common, and kids are just real smart. You know, they're not going to eat something that hurts their tummy. So the only difference is, unfortunately, they start to make that correlation with foods that may or may not be hurting them until the point where they're eating, 4 or 5 foods. And that's kind of where many of the kids are when they come into the practice. So they've just learned over time what bothers them and what doesn't. And for whatever reason, this actually makes sense, right, to eat these foods. Now, we know they're not great for them, especially some of the kids eating really unhealthy foods all day, but it's, for whatever reason, what they'll eat. So what we have to do is get the reason why they have a tummy ache fixed before we really expect them to eat well, which is a lot of reasons why a picky eater, if they may not do well or may not make any progress in feeding therapy, and it's really because they don't feel well. It's not a matter of texture. It's really a matter of not feeling well. So that's always something to keep in mind. If you didn't have a lot of luck in feeding therapy, don't be discouraged. It's just there's another issue there that needs to get fixed before the picky eating will abate. Here's how the digestive system affects the brain. So you have digestion. Leaky gut is just a common term that we've used for a long, long time. And what this means is basically there's gaps. There's kind of, I imagine if we all imagine a big fence set up, and through those chambers that could swing open and close. Leaky gut is when food gets through there before it's absorbed, and maybe it even shouldn't get through. So the channels are very sloppy. They're very leaky. There's no guards really standing there to say, okay, this food's digested enough, we'll let it through. At this point, the guards have gotten fired, no one's there, and stuff is just leaking everywhere. Dysbiosis is really just a fancy word for imbalance in the gut. And this could be yeast, candida, which many of you have probably read about. Not enough good bacteria, which is likely a lot. And then, of course, parasites. So those are all the different things that we could have a unfriendly gut waiting for us or affecting our brain. Decreased absorption, that kind of goes back to food, right? So if we take in food and we take in nutrients, ideally, in a perfect world, we would absorb it and we would use it correctly. The problem is children with autism don't absorb food great. They don't take in food the way that they should. They don't digest well overall. Detoxification, of course, they innately, just by the way that they're built, don't detoxify well. Some worse than others. Food additives, things like that, they don't work through well. That's why we do a lot of special diets with children, whether that's, a salicylate Feingold diet or a gluten-free, casein-free diet or an SCD diet. These are all probably acronyms that you're familiar with. But whatever the case, there is something in that process of breaking down food and then using detoxification properly that's just not working right. Of course, we could add here genetics as well. which can definitely mess with the detoxification pathways. Immune system, of course, as we talked about, 70% of the immune system is in the gut, right? So if the gut is inflamed and angry and upset, your immune system probably isn't going to work that well. So these are the kids that may have started out life with chronic ear infections or had strep a lot or had croup a lot, whatever the case, they're not typically well children. Although I do have children with autism that are hardly sick. So they do exist, of course. Decreased immune response. So when your immune system is constantly being told misinformation because your body has inflammation, it doesn't know when to respond correctly. So then it just starts to decrease its immune response because the army that typically goes out to fight isn't even there anymore. So you're actually losing that army as the inflammation is time. And then, of course, food sensitivities affect the immune system as well, because any food that our body doesn't agree with creates an inflammatory response inside the body. And these three things together are what creates inflammation in the brain, toxic buildup, and, of course, abnormal neurotransmitters, which are things like serotonin, norepinephrine, epinephrine, which can be tested for. So I wanted to show this in a couple of different ways because I know everybody kind of grasps information differently, and I'm a visual person, so I like this kind of stuff. So evidence of GI and nutritional issues in autism spectrum disorders. For those of you that may not be convinced through your reading about the correlation between this, I'm hoping by the end of today you will be, because there is a huge clinical and scientific evidence to back up all the things that we as doctors tell you about when you bring your children with autism into us. And the Journal of Child Neurology actually posted this in 2009, and that they're looking at the malabsorption syndrome associated with the central nervous system dysfunction, which is the brain, right, suggesting that nutritional deficiencies may be the determinant of developmental delays. So when I read this, I thought, okay, well, it would make perfect sense for children with autism to be properly supplemented and, of course, have any malabsorption syndromes taken care of and kind of squashed, if you will, so that they could function better. And if this is the context in which we're talking about developmental delays, the delays that come with autism, and those, of course, can be a huge gamut, then if we work on really putting improvements long term, and that's really what this is all about, is autism a gut disease. So that's something so much on that, speaking about that. And now, there's different things to talk about. What's kind of the popular thing to talk about with autism, but really the literature backs up that GI symptoms are present 80% of the autistic population. So you're going to be hard pressed not to find a children who has food allergies, has a history of reflux, abdominal pain, which we don't know if they're having abdominal pain, right? Especially those that are nonverbal. And even the ones that are verbal, they tend to have an excruciatingly high pain tolerance. So we wouldn't know if they were having abdominal pain in the traditional way. But there are different behaviors that I ask parents about that would be indicative of abdominal pain. So these are just kind of the statistics on when they did the scope, this is what they found. And these are pretty big numbers when you're scoping children to come out with. And these actually show up in urine, stool as well when you do them. So there is less invasive ways to look at this. This, of course, is the prevalence. I just put this in a different two papers that were published. The prevalence of GI issues in autism spectrum disorders. Of course, you see enterocolitis, esophagitis, abdominal pain, chronic diarrhea, gastritis, constipation. And so each percentages, and this is just huge, huge, huge. So I always tell parents with those children with autism, whether I'm giving giving a talk at a conference or speaking to you more intimately over this webinar or in my office, of course, I always say if you don't get the gut right, you will make very little progress. And that goes kind of across the board. And you can see why, just based on the percentages and the different, how very, very much kind of in your face this is. And you can't always tell that. And that's the hard part, is some parents will say, well, they seem to be okay, or we kind of look at the outer surface of how they're doing as a as a way to gauge how they're doing inside, and that is probably the biggest mistake that we could make. And I say we as both as parents and as clinicians. If you look at a kid and they look fine, that's not an indication for how you should treat them or how they should be treated. I think that some of the most healthy-looking children tend to have some of the most shocking lab results when I run them, whereas my severely autistic children, I'm thinking, okay, we're going to get these labs back and it's going to be terrible. They're not nearly as bad as they look, right? So don't let how your child appears to you to be the gauge of how you seek out care or if you seek out care. It's always better to know than not to know. So the key to health lies in the gut. That's kind of where you all need to start. These are the red flags. So when I talk to parents about, I've asked, well, lots of parents have asked over the years, specifically when I'm at conferences speaking, well, how do I know if we really need to see someone? Because let's say I only have one child, and I definitely only have one child with autism, so how do I even know that this isn't normal for a 7-year-old or for a 4-year-old? So these are the things that I wanted to kind of put up for you. And, are you getting complaints about violence and poor behavior? And I will tell you, it's not one of those things that necessarily, some parents will absolutely be able to tell me hands down, yes, they're biting or they're scratching, or they're having issues with inattention, or we can't take them out in public because they have a meltdown because it's a change in mood environment. But you'll want to talk to your caregivers, your teachers, your neighbors. How they act with you may not be how they act with them. They may act better or worse, but I think it's always really good to know how they're behaving. Everyone's opinion in the mix. Are they sleeping? Are they falling asleep and staying asleep all night? That would be a red flag or not. Are they a picky eater? Huge red flag, perhaps one of the most common that I see. Parents are told that picky eating is normal, that they'll outgrow it. And I will tell you that they're picky eating because they are in pain and they do not feel well. So please, this is not good. Do they have a bowel movement daily? This is another one where I have parents that say, well, we were told it was only once a week. That's not okay. I always tell parents, hopefully you have your own bowel movement a day, and if you can imagine skipping 5 days without going poop, how horrible you would feel. Now times that by 10, because you've got that child with autism may have constipation, may also be picky eating and not sleeping. So they're probably really feeling terrible. And are they hard to manage? Do you just find them hard to manage overall? Maybe they used to be a little more compliant, and maybe the older they're getting, the harder they are to manage or predict. And predictability is really important, right? For those of you that like to get out of your house with your children, we want to know that they're going to be able to handle the environment that you're going into. Of course, do they struggle to complete tasks? This is a big one, and this is almost always yes, unless it's something that they want to talk about or they want to do, then they're okay with it. But if it's something you want them to do, it's a whole other issue. My favorite thing to ask, particularly of the parents that have children with Asperger's, is they're so incredibly bright and a lot of times so verbal, almost to the point of you can't get them to be quiet about certain things. The thing about a child with Asperger's is they will typically want to talk about only what they're interested in talking about. So if you don't want to talk about it with them, then they just won't talk. They'll go into the other room and they'll go play by themselves. As children, it'll be a little bit different, maybe if they're not as verbal or maybe as, social. But what they'll do is if they're playing a game with children and it's not a game that they want to play, they will avoid it. But you'll notice that they are more social if it's something that they're controlling and or saying, no, let's do. So you'll want to look for those things too. And of course, do they get angry or show anxiety easily? And anxiety can be all over the map, of course. So there will be some children that will do more stimming when they have anxiety, get excited. So those can actually be one and the same. So that you'll want to kind of note that for your clinician so that they can get an idea of, are we dealing with anxiety or are we dealing with slapping or stimming when they're excited? Have you hit a plateau in advancing in school or therapy? This is a pretty common one, and I think it's because kids, they want to make us happy by nature. They're pleasers by nature. And so when they've hit a plateau, there's usually a reason why. And it might be because they're not feeling well, or they can't, they've taken all that they can. And so it's always smart for you to look into the medical reasons why they may be plateauing. And of course, is there any sign of eczema, rashes, bloating in their tummies, or dark circles under their eyes? Those are also indications that you would need to go see someone. If you want to read a little bit more about the 4 red flags, it's in my book. It's one of my favorite chapters, and I kind of walk you through flags are specifically, what to look for, and give you lots of examples of other parents so you can get an idea of what to start looking for. So that's something that you may find helpful. So what can you do? I think first and foremost is what's happening, right? Biomedical or integrative care is a great thing for you to seek out, because this is really the belief that the psychological symptoms that you're seeing, because a lot of people still think autism is a psychological condition, which it is not, but the psychological symptoms that people are seeing, yourself included, are a product of physical issues that they're experiencing. And by addressing the physique, then you'll see an improvement in those symptoms that we've talked about today. So often parents are told that their child's diagnosis is a result of genetics or it's psychological in nature, so that there's really nothing that can be done for it. And that is truly, truly not the case. And I think had I not had 8 years of experience to be able to tell you that, it would still be hard for me to wrap my head around that if a child is fundamentally not taking in nutrients and not getting the proper vitamins and minerals, which truthfully no child really is, just the child with autism will have a lot more of those deficiencies and a lot heavier of a need. Nutrition, of course, I think it's important that you address the deficiencies that they don't have in their diet. Go to someone to get some help with making diet changes. And a lot of times with diet changes, I think gluten and casein-free is a great place to start. Sometimes parents, I will say 75% of the time, they see a significant improvement with the gluten-free, casein-free diet. But I will tell you, be very cautious in passing judgment on whether it's, quote, working or not. I always tell parents, a gluten and casein-free diet, if parents get any benefits of this from a behavior standpoint, then that's just kind of cherry on top of the sundae. However, what I'm really doing it for is that inflammation. Gluten and casein are very inflammatory for a large majority of people. So if I can get just those things out of the diet and help decrease inflammation, that's usually why there's been such a reduction in behaviors on the diet. Now, you don't have to be on the diet for a year to see results. This is just what this specific study reported. I will say you'll want to give it a good 90 days at 100%, not 60%, not 75%, not only when we're at home. None of that works. And let me tell you why. Nobody, including myself, can predict how sensitive your child is to gluten or casein. So how much is it going to take to tip that tower over until it crashes? I have no concept of that. And testing isn't even going to really tell me that, because nothing tells us better than the child's reaction themselves. So you'll want to make sure you are 100% gluten and casein free. Use and ask them at their service desk, tell them that you're on a gluten and casein free diet, and they can give you basically this large handout, and it breaks down every product in the store and whether it's gluten or casein free, so you can almost go grocery shopping by the list, and it'll make it a little bit easier. Of course, I think it's been made pretty easy with the labeling that they do at Whole Foods specifically, but if you want a little more guidance, you can use that handout that they will provide you, or you can get an app on your phone and put in gluten and casein as allergens, and then scan it with your camera phone, the actual package of the food itself, which is very handy. Last thing, and not because it's number 4 or because it's not important, because proper testing is probably the most imperative thing. When parents say they want to get better or they were with this, they want the same results that, Tommy got, I always say, in order to get those results, I'm going to need to know what I'm dealing with. And in order to know what I'm dealing with, we're going to need to do testing. So when I say proper testing, I mean, I have kids come in all the time with a whole stack of labs that they've had run in the past. And some of it's helpful and some of it's not. So, and everyone's a bit different as far as doctors go. Some doctors will read the report and say everything looks normal, and I will pick it up and read it and say, actually, it's not normal, and here's what I'm seeing. So it's a matter of what you're ordering and then, of course, how you're interpreting it. I'm always looking for early signs that something is going wrong. I'm not waiting for something to necessarily get out of range before I start attacking it. And I think that's something that's been very helpful in my own practice. Of course, nutrients necessary for growth and development. If you go to our website, the mychildwellness.com, at the top you'll see pediatric nutrition, a section for it. You can click on nutritional supplements, and there is going to be research studies that I posted. And I read all of these, and they were the basis of my new multivitamin that I formulated. And it was basically making the case, and you can also read about the OptiPD on our website, but it was basically making the case with all these research studies that no matter how clean it is, because of the transport and the way our child's body works or their deficiencies or inabilities to do certain things in their body, every child needs a good quality multivitamin, thing that I attacked in our pediatric line. Of course, for me, I had to make it so every child could take it. Of course, that's not always going to be the case, but in a perfect world, it's vegetarian. It doesn't have any milk, gluten, casein, eggs, fish, peanuts, wheat, corn, yeast, soy, stearates, or preservatives. So they are capsules, and you would pop them open and put them in orange juice or lemonade. And we actually give directions on how to do that on the healthykidsnutrients.com. When you order it, there's actually directions on how to give it. And I did it in a cat form where you had to mix it because I could stay away from preservatives, like artificial flavorings and colorings and things like that, sweeteners. So I wanted to have it no flavor, and it's actually worked out phenomenal. So in orange juice, you can't even taste it, which is fantastic. Very heightened smell. I can't smell anything, but that doesn't mean your child doesn't. So I always tell parents to use it with a cap and put the lid on it. What you'll want to do is take the multivitamin that you're using today, and you want to look at the label. And some really important things that I want to point out. Just because you buy something at a health food store does not mean that it's good. That's the first thing I want to say. I know that there's plenty of parents in my 8 years that have said, well, I bought it at the health food store, and they wouldn't carry something that wasn't good. And the truth is, they're just carrying things, right? They don't know what manufacturing goes into that, and they quite honestly don't. That's not their business. That's not what they care about. So you'll want to make sure that there's active forms of your ingredients and nutrients in the current multi that you're using. And the best example that I can give you is, when it just says, B2, and it doesn't give you the form of B2 or B3, most likely that's not an active form, which basically means your body doesn't know how to absorb that or utilize it. So it's kind of a waste. The best example I can give you, going back to that, is folate. So this is probably the most dangerous thing to have in your multi that is not active. So what is inactive? It'll say folic acid. And it won't tell you what form of folate it is, and that can be very dangerous, specifically for those children that have MTHFR polymorphisms, which are about 40% of our population in general, and the majority, I'd say probably 95% have MTHFR polymorphism. So the quadrafolic, which is a natural biologically active form of folate, is the best form of folate that we can get into a multi currently, which I'm very, very proud that we have it in there. We do manufacture in a facility that's GMP and FDA compliant. So that makes me happy as well. And then we've got really great minerals, active minerals in there, as well as a full spectrum of everything that you need. So the good thing is if you decide to do a gluten and casein-free diet, a lot of people worry about the calcium that's taken out because you're not doing milk and things, and everything is in here that you would need from a mineral perspective. So calcium, magnesium, vitamin D, all those fun things that you get will be in the multi, and it's kind of easy to do. So here's the case type that I wanted to go over, just to kind of that we talked about today. So this little boy came in. He's 3 years old. His chief complaint, they told us, was autism. The onset, they said, was at 6 months is when he started to have delayed milestones. And then he would line up toys. He liked being held tight. So he was sensory seeking, he liked jumping, he liked pressure, and he had difficulty with transitions. His immune system, he had been sick every other week since as long as they could remember, and he at 12 months. Behavior issues, when he got angry, he would bite, he would bang his head, and his tantrums would last, which is a long time for a 3-year-old. And they would get, really, the parents would say, well, you know, it's when he doesn't get his way, he gets upset, which all that could go off to he's 3 and he's just having a temper tantrum. Or is he? Is he having a tantrum because he doesn't feel good or he can't communicate what he needs? Sleep, he has trouble waking. Night, has a hard time falling asleep. So on both ends of that, he wasn't really sleeping well. And then diarrhea, he'd had that twice a day since birth and has been really just liquid at times, completely liquid. Occasional bloating and a really, really bad odor. So this is all the information that we gathered and that was told to me. When I examined him, he had eczema on his face. He had dark circles under his eyes. He had a subluxation, which is needed to be adjusted in his neck. A chiropractic adjustment was done. And his lymph nodes in his neck were swollen. Treatment, we treated the diarrhea by doing the dysbiosis treatment. So when we got back urine and stool and blood work, we realized that he had some stuff going on that needed to be cared for, so we worked on that. We addressed his gut inflammation with supplements, and we treated his behavior and aggression naturally after finding out that he had low cholesterol. So often I do a lipid panel. Well, on every kid I do a lipid panel. And oddly enough, you know, when you and I have it done, we're looking for high cholesterol. But in this case, I'm actually looking for low cholesterol, which can be a big reason why children have behavior and aggression, on top of the dysbiosis, which is another huge, huge thing. You take both of those together and you've got exactly what this child is presenting with. I coached the parents through giving supplements because this was really a struggle for them, and it is for a lot of people. I think the thing to be that's most important is that if you're going to a doctor, that you ask them what these things taste like, what you should mix them with, if they don't already tell you. I taste everything that I give the kids, and I coach my parents through everything. So you know, you may want in their office that does that, but don't leave there without finding out how to do that, because once you have a couple of unsuccessful doses of supplements that don't work, your child isn't going to want to take them anymore. So we really want to make sure that you're getting coached properly. A month later, he had not been sick, which was amazing and perfect. Through the night, his bowel movements were normal, his eczema had cleared up, he was eating more, and he was socializing and playing well with others. The poor behavior was really gone at that point, and he was much, much happier. So some children, as he was, are pretty straightforward. I would say the older they get, sometimes the more broken the issues are. But I think this is such a great age because there's so many improvements that can be made at 3. And you're kind of still the boss of them as a parent. You know, you're kind of still can get things done. The only thing that gets more difficult as they get older is they just have they're a little more stubborn about things and they want things a specific way. But there really is no age in which you can't get help. So I've had people come to me in high school because back when they were kids at 3 and 4, there was nothing to do other than to medicate. So they're wanting to go down this journey later in life. And there's just other things that need to be looked at that point. But I would always tell you, it's never too late to get care and to get some help. It's always better to know what you're up against than to kind of be in the dark about it. So what can you do at home? I think the first thing that I always ask parents to do is to write down your goals, because everyone's going to be different. And your goals, your husband's goals, your teacher's goals, your nanny's goals, your provider of daycare, they all might have different things that they'd love to see your child doing. So I would write down your goals for your child, which then this helps direct you on, okay, where do you actually go from here? I make referrals out for therapy and things when parents either want that and they haven't been able to find the right fit, or I see a need for it and they're not already doing it. Start keeping a record of the behaviors and what they're eating and their activities. So it's always kind of easy sometimes to scale of like 0 to 5. 0 is, you know, they were a perfect child that day. 5 is, you know, you would have given them away at the end of the day if they were any worse than they were. So you can kind of get an idea of how of how bad of the day that is, together with the food that you're feeding, to give to the provider that you're going to. Because sometimes we, just through all our years of experience, can pinpoint a couple things that we may want to try before we're really ready to do food sensitivity testing. Get on high quality whole foods, organic. You can go online and get a list of the clean 15, the dirty and clean list. So if you had to pick from a financial perspective on what you feed organic and what you don't, it really gives you a good idea of where to spend your money organically. Of course, fast food and processed foods we want to try to eliminate. Get on supplements with your doctor. I would not encourage you to do this on your own. I have parents that do this on their own, and to me, 9 times out of 10, it's a complete waste of money. And that's only because you don't know what you're looking at on the label like your doctor will. So it's one of those things that, you know, I would always get guidance from somebody. Remove pesticides and chemicals from your home, you know, switch out to natural cleaning agents. Of course, get tested. That's super, super duper important. And find a doctor to help you, because I always say this is a journey. It's more of a marathon, not a race. Our treatment philosophy here is kind of combining different approaches to medicine, alternative and traditional. I have a chiropractic background and I have a nursing background. I can kind of combine one of those. So if that's something that you're looking for, that might be part of your goals, that you're okay with medicating or you're not okay with medicating. And those are things that you'll want to write down so that you can find the right person. For us, our success is really through natural sources, 90% of the time. Other times we definitely have to do things from a medicinal purpose. But supplements are very powerful dietary changes when coached properly and done properly, are amazing. Craniosacral therapy, which is something we do in our practice, and you can read more about that on our website. And then, of course, chiropractic adjustments, laboratory testing is all part of what we do in our practice. What we don't do is therapy. So I love to work with your occupational speech, physical therapist, whoever is in the mix, to try to help them understand what I'm doing if they don't already understand this philosophy and this kind of care, so that you have better results all around. I think it's really amazing when everyone can be on the same page and be knowing, this is what I'm doing, this is what you're doing, and we can try to work as quickly and efficiently as possible to get your child as well as we can. And then, of course, this is something that I always tell parents: don't wait to get a diagnosis to go get help, because having a diagnosis is just really for insurance purposes. It's not because the doctor needs it so they know what they're doing. Most all of us, I don't treat based on whatever label you bring into my office, and I know many don't. So, but of course, that's kind of what we teach you as parents, that, you need to go get this evaluation and do this, and we need to have a name for it so we know where to go. And quite honestly, when it comes to this type of care, because there are so many symptoms involved, a lot of times, it really isn't something that you need to have a diagnosis, up and kind of in the works for. So just know that I wouldn't wait for a diagnosis. I would just go and seek out help if any of those red flags or signs and symptoms are something that you're experiencing at home. Here are the next courses. April 28th, we're going over craniosacral therapy. It's slow in development and healing. I've been doing this therapy for 9 years, and it's amazing. So I thought I would actually have just a webinar on that, just to kind of introduce you to it and walk you through how it works and what it is. But you can check out our website for a little bit of information ahead of time. Wednesday, May 13th, we're going to be doing strategies for behavior changes. So this isn't going to be autism related. This is going to be other behaviors. So I really wanted to have one on autism, because those behaviors are so different a lot of times from just the kids with ADHD. These, of course, are free to you. You can sign up now. They're actually available as of yesterday at the dramberbrooks.com website under education. And then, of course, you can stay in touch with us. This is our office email, and you can get on our mailing list if you want to get our monthly newsletter, and we try to give information there. Again, the Healthy Kids Nutrients, which is where the multi is available for sale, that's on that website, which you can check out, and I have dosing instructions on there as well. And, of course, Facebook is a great way. I always am trying to put things up there that would appeal to parents, that could maybe help you. The YouTube videos, like I mentioned in the beginning, are a great way to get information. So you can go to the YouTube channel and just see the videos that we've done over the last few months and see if any of those would be helpful to you. And of course, our private practice, we have lots of information. So I wanted the website to be a resource for you, and we have pages and pages of research directly linked into the website. So you can literally click on the link and it brings you to the actual study itself. So if you're wanting to know more about something, or you feel like the doctor in your area is you don't quite understand what they're trying to tell you, you may be able to find some information on there that may be helpful to you. And actually, sometimes, believe it or not, and I know you will, but you're kind of the one that wants to get care, and your spouse or your parents or whoever is not really convinced that there's a problem. So sometimes the research isn't so much for you, but for the people in your life. So that's that, really. Those are the websites you can keep in touch with our office information. Are there any questions? Say. Anyone have any questions?